Today, I will share how biomagnetism helped the client achieve remarkable progress in just 3 months. In February, a 19-year-old client came to my practice suffering from severe atopic dermatitis, a condition she had struggled with for 3 years. Despite trying various dermatological treatments during that time, she saw no significant improvement. By the time she visited me, both she and her family were desperate for relief. After evaluating her case, I believed biomagnetism could help and offered to guide her through a 3-month therapeutic protocol free of charge. I explained that since her condition was chronic, consistent biomagnetism sessions over this period could make a meaningful difference. In biomagnetism, I often recommend that patients commit to therapy for at least 10% of the time they have experienced symptoms. Since her dermatitis had persisted for 3 years, a 3-month protocol was ideal to allow for substantial healing. Therapeutic success with biomagnetism is well documented among practitioners, and we have previously shared some of these cases. See the link in the description for details. However, in those early examples, the approach relied heavily on full-body scans, with varying pairs applying in each session, making it difficult to establish a standardized protocol for research. This case was different. Instead of a full scan, I focused on applying a specific, refined protocol twice a week, one I have been optimizing over the past few years. The sessions began with the following pairs. 1. Liver-liver. I use this one for detoxification purposes, although the action mechanism is still unknown. There are only reports that the negative is useful for fatty liver in preclinical studies and that this organ has magnetite 111, which could make it sensitive to magnets. 2. Intestines. For gut microbiota modulation and intestinal barrier repair. Here, I simply place negative magnets in the abdomen to improve the intestinal microbiota and favor gene induction of interleukin-6, which helps in closing intestinal permeability and preventing leaky gut syndrome. Reducing all kinds of toxins could reach in the bloodstream, which translates into modulate little by little the inflammatory response. And this positive magnet was for constipation, a problem that she suffered for several years as well. 3. Hip-hip. I stopped using this pair for 2 years and I noticed a decrease in the effectiveness of my therapies, most likely due to the immunomodulation effect that the magnets could have on the bone marrow. Preclinical studies suggest that static magnetic fields influence immune cell activity, though further research is needed. 4. Thymus for immunomodulation and anxiety control. The mechanism of action is unknown, but I believe it has to do with the effect of the magnets in the thymus and the bone marrow on the sternum, and also the magnetite 111 that have found in the heart. 5. Kidney. For detoxification, although research is lacking, it is only known that the negative is nephroprotective in cases of diabetes mellitus in preclinical studies. 6. Adrenal gland. To regulate the cortisol levels in the blood, we still need to know which polarity activates or deactivates certain hormones in this gland and how it behaves under certain conditions. I use both polarities to balance both effects of activity and inactivity. 7. Cervical plexus, to regulate the function of the vagus nerve. In this case, it may have been the key pair for her recovery because the client also had dysautonomia problems that could exaggeratedly activate her alert system even with temperature changes, thus favoring frequent reactivations. 8. Temporal. To favor gene induction of proteins related to potential upregulation of neuroplasticity to stabilize emotional processing. 9. Frontal, to enhance prefrontal cortex connectivity to mitigate anxiety and frustration feedback loops. 10. Palm and brachial, to reduce muscle tension and sympathetic overreactivation. The application details of this protocol was frequency, twice a week starting at 4 p.m. and ending at 5 p.m. Duration, 1-hour sessions in a calming workspace with Tibetan singing bowls to produce relaxation on the client. Timeline, 3 months total. Equipment, 1000 Gauss ferrite magnets lined with leather. Progressive results. Symptoms decreased steadily across the 3 months, with temporary reactivations noted during weekend breaks, when no sessions occurred, also when she had her period once a month. Classical biomagnetism excels through highly personalized full-body scans, a meticulous approach that tailors magnet placement with near-surgical precision. This artisan-level customization delivers exceptional results but possesses challenges for reproducibility, as outcomes may vary significantly between practitioners, example an novice versus a 15-year biomagnetism expert. While this individualized method remains the gold standard for patient care, it complicates scientific validation. Research requires standardized protocols to reliably assess efficacy for specific conditions, akin to pharmaceutical trials, where reproducibility, patient profiling, and dosimetry are fundamental. Why protocols matter? Research credibility enables rigorous validation and collaboration with medical scientific institutions. Regulatory pathways facilitates compliance with health authority requirements. Practitioner accessibility allow less experienced biomagnetists to achieve consistent results. This marks a pivotal shift. Biomagnetism now mirrors drug development principles, blending classic knowledge with evidence-based methodologies. The key benefits of biomagnetic therapy in such cases include reduced frequency and intensity of symptoms flare-ups, decreased reliance on aggressive pharmacological treatments, offering a more gentle and cost-effective approach. While biomagnetism has proven effective in stabilizing this condition, optimal long-term results require maintaining a healthy lifestyle to support the therapeutic effects. And remember, if you'd like to know more about biomagnetism, subscribe to my social media channels. Thank you and see you soon.